A case of tuberculosis or TB detected in a person at UC Davis. Yolo County health officials telling Fox 40 tonight that TB cases in the county are not extremely rare, with some people acting as carriers of the infection without ever showing symptoms. However, this type of contagious TB is far more uncommon.
About 10% of people with the inactive infection at some point in their lives will convert to an active infection that is contagious, and they will have symptoms and they'll be infectious towards other people.
In the middle of cold and flu season, the symptoms of TB can be similar to other sicknesses, but more extreme. Among them, coughing that can last weeks, chest pains, coughing up blood, and physical weakness.
We're not looking at a cough for a couple of days. We're looking at a cough for weeks or a cough for months, and then potentially that cough progressing to coughing up blood. The severity as well as the duration of the illness can really point towards tuberculosis.
And while TB is curable, it must be addressed with proper medicine, with the contagious variety needing much more attention in treatment than the inactive version.
Whereas the active infection usually takes 4 TB antibiotics for 6 to 9 months.
And that health officer you just heard from also adding that their office has been in contact with some of the people that they believe were in contact with a person who tested positive. As for the risk to the general public when it comes to this TB case on the campus of UC Davis, they say that is a very low risk. On the campus of UC Davis, covering local news that matters, I'm Eric Rucker, Fox 40 News.